Tim, welcome to Let's Talk Quality. How are you?
Good. How are you today?
I'm good. Thank you for joining us. We've known each other for some time, so it's good to have you on the show. For people that don't know you, please give the audience, the listeners, a very, very quick high-level overview of who you are right now, what you're doing, and then we'll sort of work backwards from there.
Yeah, sure. I am the vice president of quality for a company called Aktis Oncology, headquartered in Boston. We're a radiopharmaceutical company targeting various types of cancer. I've been in the industry now for 47 years and have seen a lot of change over all that time, and glad to be here with you this morning.
Excellent. Thank you very much. So 47 years in the industry. If you go right back to the beginning, I know it's a while ago, but how did you get into science and how did you evolve your career into a quality role?
Actually, my father was a full lifetime employee with Eli Lilly and Company, and the Eli Lilly facility was just down the road from where I grew up. And he was able to get me an intern position while I was going to college at Purdue. And it all started back in 1980. And once I got there, I just kind of fell in love with the whole environment and wanted to pursue the sciences and pharmaceutical development, manufacturing, and just stayed in it. And it's been a very interesting field to work in.
So what was your first role?
My first role was I was a fermentation operator. It was a great big antibiotic fermentation plant, antibiotic production plant. And we had these huge fermenters that, any 60 to 90,000 gallon fermenters that went down into the ground. And my job was to go around and monitor the temperature, inoculate them, harvest the fermentation broth from it, and send it on to the next department to get purified. So it was a very big, loud, industrial kind of environment. Not at all like the shiny silver tanks and pipes that we've got now in the biotech world. It was kind of a big, dirty place.
What did your father do at Eli Lilly?
He worked in the neighbouring department where he oversaw the purification, so that this raw fermentation broth would go into his department, and then his group would purify it and send it out as this very pure, clear amber liquid, which would get a tanker truck down to Indianapolis and turn into a crystalline powder that would get filled into pills, capsules.
Okay, so it was in the family then. You
Yeah,
you had no choice almost.
yeah. I ended up marrying a pharmacist, and so did my sister.
you?
We're all kind of in that world.
Very good. So we won't talk about the whole entire career, but I've spent 40 years in the industry. When did you sort of remember your first actual quality position? Where was that?
Yeah, it was interesting. I had spent 14 years with Eli Lilly at the beginning of my career, and I got called in to join a team of people that were to plan out the validation of a brand new clinical manufacturing site. And I didn't know what validation was. I don't think any of us really knew. And all I could gather was that the quality organization at Lilly was responsible for this function, but my role was to represent the users of the new clinical manufacturing area. And it's kind of when I started to get into the whole quality compliance kind of arena, and wasn't really sure that I wanted to get into it, but I think somehow that role of quality and compliance suited my personality real well. And before I knew it, I was in that area and to stay.
Yeah.
But
So
I started out as a manufacturing, person.
So, as you know, our audience is quality professionals at all levels, ranging from people that are early on in their career, just stepping into management, or seasoned leaders. For someone that's been through, 3 or 4 decades of quality leadership, looking back through your career and the industry as a whole, what are some of the trends that you see, in terms of as your career has evolved? What have been some of the defining changes that have happened? Because obviously, as everyone knows now, we're going through a more of a digital and AI change. So, that's probably happening right now. We're probably right in the mix of it. But if you think back to your earlier career and throughout, what was quality like then? How has it all changed over the course of the last 30, 40 years?
Yeah, it's really been an interesting journey. Back when I first started, the GMP regulations were only a year and a half old. They were strictly intended for commercial manufacturing. I don't remember there being a quality assurance function All we had back then was QC. And I don't really think, I think the industry kind of looked at the GMP regs as kind of guidance. I don't think they were following very well. So we migrate through the 1980s trying to apply them, but not doing a very good job of it. But by the 1990s, the FDA stepped in and really started to come down hard on the industry that they had to comply. And as the 1990s kind of continued to pass by, I think at some point the regulatory agency realized that they need to apply to clinical manufacturing as well, and emerged from all of this started to become the quality assurance function, which was very much this compliance kind of role. QC started to become more purified as a laboratory QC testing kind of function, but QA was kind of hiding behind the regulatory flag. It was a good compliance. It was very much a desk job, paperwork, just reviewing documents and SOPs. But then when we get into the 2000s, the quality role really, I think, started to expand, and it started to get into all the facets of the way manufacturing operations is working, applying GMPs. We're starting to get ICH guidance documents coming up on the scene. The awareness that the European regulations and regulations around the world all were a little bit different, and the quality role, I really think, started to get its modern day roots in the mid 2000s. And then by the time we hit 2010 going forward, I think quality really started to establish itself. And I really think that we have found that the quality role for a commercial operating company is quite different than quality for a young developing biotech company. It's really hard to apply GMPs in an early clinical setting. So I think there's a lot of creativity that takes place. And now we're getting all kinds of new technologies coming to on the horizon. So again, the quality role's got to get a little bit creative and look at ways to control technology. Maybe that where in the past the old historical methods don't work anymore.
Do you think that then changes the type of skills that people need to become strong quality professionals, strong quality leaders?
Yeah, it really does. One of the things that I've noticed is that people who have engineering and manufacturing understanding, people that are deep into the science of the technologies that they're working with, really can benefit the company in their QA role. Some of my strongest QA members on my teams have got these unique experiences that just really make them able to blend in with their operational counterparts and to add value. So, I think we're getting away from this generalist who, again, is just reviewing documents and asking a lot of questions to quality members that can sit on, teams and add value and help guide the company forward.
Yeah. I mean this in a very respectful way. It sounds like quite a monotonous type of job 30 years ago when you just sort of getting into quality type role,
It really
reviewing.
was, and
Yeah.
and a lot of people didn't want in it. The old saying was, "Well, it's just nothing but a bunch of paperwork, and if something goes wrong, you're the first person to get blamed." And no, it was not a very glamorous role, and again, I'm glad to see that it's becoming more of an entity within itself, and we're a contributing organization. And quality's made up of so many different facets now, from manufacturing to regulatory compliance. We've got clinical QA now, and so there's a lot to it.
And do you think that, because one of the conversations I always have is how people fall into the role of quality. Quality isn't a university or college degree. It's not necessarily something that kids grow up wanting to, or having an awareness of. Do you think that's just because of what we've just sort of spoken about, is the unglamorous nature of that quality role, say in the last few decades? And do you think that might change over time?
Yeah, you're right. Early on, people that fell into the quality role, I think, pursued it because of their own personality. People that were very detail oriented, very systematically minded. But now we're starting to see quality organizations made up of a variety of people with strong different backgrounds, from the sciences to computer technology and systems to chemists, biologists. So I think it really has opened itself up for a wide variety of educational backgrounds to come in and be effective in quality. And one of the things that I do when I recruit people is to really help them to understand all the opportunities that exist. And there really are a lot of them. And so again, as you mentioned, it has improved in the right direction over the last decades.
Let's talk a bit about that then. When you do grow your team and hire people, and you want that to open their eyes up to the opportunities that exist. If you put yourself into that position of growing a team and hiring and interviewing people, what are those opportunities, and how are you articulating that to people?
Yeah, one of the things that, as I've been talking about, quality is very much a multifaceted role. And I think everybody that gets into the quality field wants to get exposure to all of these different facets. And I really think by doing so, it makes them a very potentially valuable quality leader for the future. So that's one of the things that I do is I try not to necessarily define and dictate how people do their role, but basically say, hey, look, here's what we need to do this year to support the company, whether it's grow the organization or help define our control programs. Let's look at what needs to be done. Let's put our minds together and get creative and figure this out. And then, I want everybody to take ownership of their role. So I find myself more of a mentor and a coach.
Mm.
And I really like that. And again, I think there's a bit of personal judgment that comes into play as a quality individual, but you want to try to rely on systems as much as you can. So I think experience is one of the most valuable things that a quality person can obtain just real life experience. And that's what I try to do with my team members is give them experience. Let's go out there. If we make a mistake, let's learn from it, correct, and go on. And I've even pulled people in out of manufacturing to join quality, which was always something that they would do, kicking and screaming. But again, some of the best quality people that I've ever had a chance to work with were former manufacturing people.
Yeah, on that point, why is that? Why do you think that is?
Well, I think that former manufacturing people have a very good understanding and appreciation for the demands that are on pharmaceutical manufacturing. You've got a technology that you've got to maintain consistently, a tight schedule to keep, whether you're making big batches of product or small batches. They're usually very expensive. We need to get them released safely, distributed out to the patients. So it really is an opportunity to do a lot. And I think that that's one of the things that attracts a lot of younger people out of college into quality is this chance to be able to oversee and have contact with so many points of a pharmaceutical operating company.
Yeah. When you obviously growing a team and interviewing people, and when you are speaking to people, how do you sort of assess the current landscape of up and coming quality leaderships? Do you see any difference in the pool of people now versus 20 years ago, for example?
Yeah, I think 20 years ago, people that came from one company in a role of quality could pretty much mimic and repeat what they did at their former company. But what I'm finding now is that there's so many different young companies out there with new novel technologies that you may have been very successful in your former role in quality, but walking into a new technology can just really be kind of like foreign land. I know when I first started to get into radiopharmaceuticals, it was totally different than anything that I'd ever worked with in traditional pharma or gene and cell therapy. So I think a good quality person needs to be adaptable. You need to be able to continue to learn and realize again that maybe what you did in the past just doesn't fit very well with this particular environment. And that's okay. You've kind of got to grow with the science.
You spent a lot of time in sort of big pharma, obviously in your earlier career and mid-sized pharma, and then if I'm not wrong, you went into sort of the startup role in the last few years. Would that be fair?
Yeah, it is. I think when I look at my own personality, I see myself as a builder. I love to bring things forward, new technologies forward that really have no path that they've ever been on before, and to get them available to people that need them. So I'm a hands-on person. I like that. I found with the big pharma companies, as successful as they are, there's definitely a strong culture that exists. And a lot of my friends in the quality world, they thrive in that kind of structured environment. I do a little bit better myself in a environment that's not so structured, where structure needs to be built and created. And that's kind of where I find I get my enthusiasm from my work is being able to take something from scratch and turn it
Yeah.
into something that works.
Do you see that the benefit of quality professionals, leaders having sort of cut their teeth in big pharma in their early careers and learned the systems and processes and then
Yeah.
made into the startup world rather than sort of been joined because like you say, there's so many startup biotechs now. There's so many small companies being grown all the time, and my concern is that people are sort of going into startups without having learned quality in big pharma or even larger organizations with proper structure and processes, and they don't necessarily know how to build commercial strong GMP systems. Is that a concern for you? What are your thoughts on that?
It's a very good question you bring up because I had the opportunity to really get raised at Eli Lilly and Company under this, very formal, traditional commercial manufacturing world where that it was refined and I was taught by good leaders. We had good systems that we followed. So it was like being in college itself. And because I don't know how anybody, especially in quality, can step into a younger environment where all that infrastructure doesn't exist and grow it. You kind of have to know what it looks like in the end in order to know where you're taking it. You may step into a young company and realize that, okay, nothing is in place right now. We're not going to turn it into a commercial company overnight. It's going to take years to get it to that. So I really do think that there's a lot of value in a person having the opportunity to work in a more established pharma company and learn what works and then take maybe some of those learnings to some of the younger companies that need that experience.
Yeah, yeah, I totally agree. I mean, I see it it's a very obviously very different industry, but I spent 11 years in a global recruitment organization from the age of 23, and I learned how to recruit, with proper systems and training and processes, and really you really had to work hard, but you also you learned it. You really learned the methods that work, and you were trained with a very clear process on how to do things. And then and then I was able to go and take that into my current organization, RX Group, as the founder, and sort of implement the things that I've learned and been taught. And I see it in a similar way, right? I've been had the fortunate startup to my career to learn the process and systems as a good sort of recruiter, and now I'm in the startup world. So yeah, I see it in a very similar light. I see a lot of good quality leaders that are in startups now, but they've learned how to build proper commercial GMP compliant systems. So yeah, it'll be interesting to see how it all evolves as more startups come up, as more quality leaders or quality professionals start their career in growing clinical stage biotechs.
I think one of the things too, now that I'm at the point that I'm at in my career, is the ability to look back at all of the mentors that I've had. Sometimes you don't realize the value that an individual is adding to your career until later. I look back and I see some very good technical and quality leaders that I worked for that injected a lot of wisdom into my thinking. So there's really no substitute for experience. And we learn by mistakes. And when you have a chance to work with somebody that's been in the industry for a while, they'll share those learnings with you, and they'll be very beneficial. So I'm very grateful for those people that helped me along the way.
So let's talk a bit about that, because I've got a mentor program which I run for up and coming aspiring quality leaders, and they're mentored by people like yourself who've been around and understand that experience. If you are mentoring somebody at the beginning of their quality leadership career, taking the learns that you've learned, what are some of the things that come to mind, the things that you would sort of focus on at a high level? And obviously everyone's different in their own situations and depends on who you're mentoring. But what are some of the key learns that you've experienced that you would help somebody with?
You bring up another good point. Everybody's different. We've all got different interests, different personalities, different natural skills, weaknesses. One of the things that I focus on is helping people to understand what skills they really need to develop to be effective in quality. And again, it goes back to being detail oriented, very systematic, listen real well, and understand the technology that you're working with. So these are like some of the fundamental things that a good effective quality person has to be patient and do for themselves. And I always tell people, be patient. It takes time to get yourself up to speed with a company and what they're doing. Don't try to step in there real quick and change things. Observe what's working, take note of what's not working that well, and come up with some ideas to improve it, but be patient. And there's just so much really to learn. And I always try to help people understand that it is a learning and growing process. I think feedback too, we look at some of the classic performance based programs through HR, and you get reviewed at the end of the year and rated. But I think real effective mentoring has to come daily and weekly. And I always tell people, don't ever take my advice personally, but just understand that, we're all perceived by our colleagues in a certain way, and we may not be able to see it. We don't ever want them to think that we're not engaged or respectful of what they're trying to do, or even sympathetic to some of the problems that they're struggling with. So again, I think it's kind of a multi-layered mentoring. And then, you get to a point where you've been working with a quality individual for quite a while, and you start giving them challenging them with, okay, here's what has happened. What would you do about this? What's the best way to document this? How would you ever explain it to an outside regulator? These are really the fun times when you can see that their wheels are really turning, and they're coming up with some very compliant approaches towards things. And I think that's really when they're adding value to the company.
Yeah. Do you enjoy the mentoring side of things?
I really do. When I was a young guy, I was one of these that I had to do it all myself. I was the only one that knew how to do things right. I was this lone eagle out there, but you find yourself eventually in a role where you can't get work done without people, and you're dependent on them. So their success is your success. And that's when I really started to embrace the mentoring role and realized how valuable it can be to share my experience and learnings with other people to help grow a strong team. So I do really believe that don't hold the knowledge in your head and not let anybody in. You're better off getting it out there and letting others work with it and grow from it.
Yeah, yeah. No, I completely agree. And so where are you at now in terms of, obviously, if you're in a sort of a startup field and you're building a team, how do you see the current right now where we're at, the quality industry? Good, bad, ugly. What's working well?
I think not long ago, I recognized that many people in quality were kind of working from a textbook mindset. You read the regs, they're kind of vague. You have to interpret them and apply them, and they were very black and white. Matter of fact, I think there was a strong consensus in the quality industry that quality is a black and white field. But I really believe that it's getting more gray. Trying to control technologies, allow clinical processes to evolve and mature and to scale up. It's not easy. You find yourself deep into the development kind of mind frame and thinking. So your ability as a quality leader is growing with the technology itself that you're working with. And again, that takes patience. You need to be able to demonstrate what you're doing to control, but you may not quite be in that perfect GMP world yet, and that's okay. I've had members from the FDA say to me over and over, document what you're doing, document your rationale, show us that you're thinking about what you're doing and how you're working your way through problems. Just having a bunch of forms and SOPs doesn't really cut it. We want to know your thinking behind it. And I think that's very valid. I think that as a regulator, I would expect the same from any pharma company. Help us to understand what you guys are doing. And I've had FDA people, say to us in the industry, you guys are the experts on your technology. We're not. If we don't understand what you're doing, then you need to help us understand.
Yeah. And how do you see the industry right now? Obviously, been a tough couple of years for biotech, generally speaking. Things seem to be, from my perspective, things seem to be moving in the right direction. The FDA announced last week that they're hiring thousands of people, which is you know, a positive sign. So, how do you see the wider industry progressing?
You know, when I go back to when I was at Purdue studying immunology, biochemistry, and genetics, these concepts were just that. They were concepts. And it's taken decades to see some of this science come to a useful application in the pharma biotech world. And I think because it's getting so complex that regulatory agencies are realizing that each company is kind of unique and they have to kind of get themselves up to speed on the technology. So I think we're seeing a much more collaborative partnership between the regulatory agencies and companies, biotech companies. Both have the same interest at hand. Both want to protect the public, but bring value and disease cure to all these people around the world. And it takes a lot of people to do this. So I think this adversarial role that we once had with the regulatory agencies is going away. I think the biotech sector is just really it's just sky's the limit right now. The ability, I was just thinking this morning, the ability to go in and genetically modify human cells in the human body is just amazing. And to correct these problems, when we look back at traditional pharma, it was all chemical drug entities. But now we're actually helping a body to heal itself and to rid itself of cancer. And it's just amazing. I really think we're on the verge of some big things here over the next 20 years.
What do you think will slow progression down?
Well, the one thing that I think happens is it all costs a lot of money. And it seems to be costing more and more money every year to run these new biotech companies. And unfortunately, some of them don't make it. And there's been a lot of investment money put into it and they get nothing back. So I think it's the generation and availability of investment money. And I think it's up to the biotech companies themselves to really teach, educate, and explain to investors what they're doing and the potential that it carries. When I talk to our CEO, he shares with me, that one of the toughest jobs he has is conveying to investors all the potential that exists with what we're trying to do, why it costs so much money, what our needs are. So again, I think a good CEO that can work in that area with an investment community is worth its weight in gold.
Yeah. And if you were to talk to somebody who is very early in their career and you wanted to articulate the opportunity and why they should go into quality leadership in 2026 and beyond, based on what you just said there around the science and the potential, and CEOs being able to articulate the story of the science and what that brings from a quality lens, how would you sell quality to an aspiring quality professional?
It's kind of an easy question for me at this point because I don't view myself and my role in quality as being this police force or trying to, find mistakes or whatever. It's being part of a team and helping. Most of the time, I have operational colleagues come to me and say, how do we best document what has happened? How do we change this and what documentation should we do? How do we do what we need to do, but yet make it understandable and explainable to the outside world? We don't ever want to do anything behind a closed curtain. So when you realize that you're helping a team and you're a part of the team and it becomes more of a collaborative partnership with your operational colleagues, that's when I know that I've gained my most satisfaction from my work. And I really believe that all people in quality, desire that and gain from it. So I always try to tell people, let's not try to find fault. Let's help to be proactive and identify things that could go in the direction we don't want them to go. Let's head that off. Let's add value to the team. In the old days, the joke was if you see a quality person coming down the hallway, you duck into another room and avoid them. I want people to see a quality person coming down the hallway and want them and want to talk to them and let's talk a little bit. I need your help with this. This is the real collaboration that we need in the industry, and I think it's well on its way.
That's great. That's well said, and it's good to hear your positivity and optimism for that for the industry. Just to, I guess, cap things off, Tim. What about where you are now? What are you excited about in your current role over the next 12 months? And on the sort of contrary, what do you foresee as the biggest challenges?
Well, I tell people one of the greatest satisfactions that one could have in a pharmaceutical career is to be involved in taking a product that's been in development over that commercial line and get it out there. I've done it a couple times, and it's very satisfying. So for me, it almost just wants me to go back and do it again. Right now, with the company that I'm at Aktis, we've got several phase 1 studies going. Our relationship with the FDA has been very favorable. We've just now got to grow up from this R&D kind of small company into a larger operationally minded company. That's not easy to do. One of the things that we realize is that the people that get you from, square one to early clinical development may not be the same people with the same skills that you need to take you deep into late phase clinical studies and commercialization. So you transition, your company kind of has to transition from this R&D kind of shop, which is very creative kind of world, to a more operational, systematic kind of company. And that's kind of what I enjoy doing right now. It's not easy. You've got a quality management system to build. You want to pull in computerized systems wherever you can to help. People some of them need to be trained a little bit more and get out of their development mindset into, instead of creating things, you want to start holding things steady and improve what you've got. And those are different skills. So those are some of the things that I see we'll be experiencing at Aktis over the next couple of years. And it's very typical for all young biotech companies to go through this.
Yeah. Yeah, well, wishing you all the best, Tim, with
Thank you.
everything that comes across over the next few months. Exciting time for you. Asked a couple of questions from me, and you've touched on a lot of this throughout the conversation. But for those quality professionals that are maybe in their early part of their career, maybe thinking about how they grow their career, do they go into how do I become a vice president? How do I get on to C-level positions in the future? What key things should and can they be doing right now to put themselves in the best possible position to get to that state in the future?
I think one of the best things that I could offer people that are earlier in their career thinking along these lines is you've got to keep in mind that you are working for a business. We get lost sometimes in all of the regulations and control concepts around GMP, but we have to understand that the company needs these drugs to get manufactured and released, and they have to be done in a safe, compliant manner. So this in itself is not easy. But when a quality individual gets kind of locked in on the control side of things, you can start to lose sight of the fact that you can paralyze a company with enough GMP rules. And there's a time and place for all of that. But a lot of times you've got to find creative ways to maintain compliance but yet keep product moving out the door. Not easy. Sometimes you can't do it. Sometimes you can. So I think keep in mind as a young quality individual that it's not a black and white world. It's an opportunity to be creative, to collaborate with partners in other operational areas of the company and find ways forward to get things done, even though there may be obstacles in the road. And I think that kind of mentality makes it a much more fun job.
I think that's great advice. Tim, thanks so much for your time. I think that's some really good wisdom, some really good experience that people can lean on in there. And wishing you all the best with everything over the next few months with Actis. And I'd love to get you on in the future to see how it's all
Thank
progressing.
you. It's been wonderful talking to you. Appreciate your time this morning.
Yeah, pleasure, Tim.
Okay.